are aware, but it's World Antimicrobial Awareness Week. The 18th to 24th of November 2021 was set aside to create more awareness on antimicrobials. And when I'm talking about antimicrobials, I mean antibiotics, antifungals, antivirals, and antiparasitics. So I don't know if a lot of us have joined the campaign, the Go Blue campaign, which aims to spread more awareness on antimicrobials here. I don't know how many of us are aware that it's actually Antimicrobial Awareness Week. In case you're not aware, now today is 23rd, so the week ends tomorrow. And antimicrobials, AMR as it's generally called, is one of the greatest threats that humanity faces today. And WHO has declared it as one of the top 10 global health threats. And it occurs when bacteria, fungi, viruses, and parasites change over time. And the normal antimicrobial medicine that is used to treat it is no longer effective. And as we all know, or maybe not all of us, but antimicrobials are like the backbone of modern medicine. So they help us treat very deadly infections, and we use them during surgery and sometimes during cancer chemotherapy. And it's overuse and misuse of this antimicrobials that are the main drives of drug resistance. And as pharmacists, we are antimicrobial as pharmacists, we are antimicrobial stewards. We should be antimicrobial stewards. So today, what we'll be talking about, based on the outline generally, will be the facts on antimicrobials, the challenges, consequences of misuse and overuse. We'll be talking about abuse of antibiotics and AMR in general, and we'll be also sharing some new information. So we have the facilitator in the house that's going to be taking us on this journey is from Merit Healthcare Limited. He's the product manager, and he's Farm Dr. Winga Alex. So he would come up now and take us on the journey through antimicrobial resistance, the new things to learn. It promises to be a very interactive session. So we will talk about our experiences in community, hospital, and other places where we've come across antibiotics and other antimicrobials here. And we would share our experience and get to listen to new information that he has. From Alex, are you on the call?
Yes, I'm on the call.
Right. Okay, so the stage is set, so you can come up, sir.
Thank you. Okay. Good evening, everyone. It's really nice to really be here, and I tell you, it's for me, antibiotics is a topic that I actually like talking about, and it's one interesting topic that personally, having worked in community pharmacy then, now that I'm in the industry section, it's one thing that I have seen a lot of things. I believe together we will learn a lot of things in the course of this program. I'm really excited to be here. My name is Ali Benga Alex. I'm the product manager of Merit Healthcare Limited. And together we will just look at what are those new things, what are those things that we can actually, what is the recent thing happening, what are those things as pharmacists that together we can agree on the way forward. It is important for us to know. Look at the topic for this year's World Antimicrobial Awareness Week. Antimicrobial resistance spread. basically on antimicrobial resistance. If we do not do anything to stop antimicrobial resistance, there will be a huge problem next time. If you look at the trend, basically, it's the newer drugs on antibiotics are not really as much as we these days. We do not really see more of new drugs entering the market. Then you get to see the broad spectrum antibiotics even being misused. This is really a cause for concern. And I believe together we will look at this together. I actually do not just want to be the only one on this call. I would like it to be interactive so that we feel ourselves. Of course, just feel free. Let's feel free. Let's talk as pharmacists. Let's interact together and fun. Thank you once again, everyone on the call, for coming around. I think I will share my screen. Okay. Just a minute. Okay, please, if you can see my screen, you can just type yes on the chat box so that I'll be sure that you can see my screen. Please type yes. Okay, thank you. Thank you from Roots, from Brian. Thank you so much. Yeah. Well, it's I believe with time, subsequent time, of course, we'll get to maybe you never can tell physical meeting such that everybody will actually will see ourselves physically and it's better. But of course, we can still utilize this period. So, as earlier mentioned, the what Antimicrobial Awareness Week is a yearly program by the WHO in which as health workers, healthcare providers, we get to at different points, different topics is being selected on antibiotics generally. And for this year, the theme is antimicrobial resistance. And for us personally, we will be looking at the role of pharmacy in the advocacy and awareness of this antimicrobial. Okay, so I will want it to be interactive, and at different points, if you actually have something to say, you could turn on your mic and keep in one or two things. And for those that are more comfortable using the chat box, you could actually just drop your comments on the chat box. Okay, so for the outline of this presentation, in fact, if it is even possible, I may not even want to use any slides. Just be for us to just talk and just get to share our experiences. To really be very nice. But for us to actually know that, okay, for us to actually, for formality purpose, if I'll put it down, the outline would be us actually just looking at the facts and antimicrobials generally, the challenges, recent challenges that we may have actually experienced in people picking up antibiotics, on antibiotics generally, different challenges that you might have seen in your environment. Of course, a lot of us are in Lagos, we are in Lagos, and different parts, we are all in different parts of Lagos. To different areas, there are different peculiarities. Different areas really peculiar. So, of course, challenges in your area may be quite different from mine. So it's an avenue for us to come together and you tell us if it is similar, we get to know. If it is different, we know new things in your area that is happening and what we can do to actually see that together we work together and we as pharmacists will make the society do the right thing. We get to talk about the antimicrobial resistance and we talk about briefly at Merit Healthcare, this is something that is important to us, but we just still chip in one or two things on what the antimicrobial use and our interest, sort of. It's just something that's very educative. I'm sure it will be very a session that all of us will appreciate. So very quickly before I proceed, I will just try to reason out. Let's look at this together. Because we all know what antimicrobials are. Antimicrobials could actually be antibacterial, antifungi, antiviral, antiparasitic. And out of these, which of these is the most prescribed antimicrobial? Is it the antibacterial? Is it the antifungi? Is it the antiviral? Is it the antiparasitic? In my territory, it could actually be a different one. Me, I actually, from experience, I actually know the one. But let's get to see, is it the same in everybody's area or is it different in everybody's area? Mary Jane said antibacterial. Okay, I would like more responses. If you want to unmute yourself and talk, that would be great. And if you want to just send it on the chat box, it will also be fine too. So in your area, which one is the most prescribed? Oluwafemi said antibacterial. Ayo said antibacterial. That's 3 of 3. 4 of 4. Antibacterial. Who else? 2 more, then I will proceed. Antibacterial from the roots. Any other person? Antibacterial, that's, well, I've seen about 5 comments and it's been 5 of 5. Okay, antibacterial. So all of us agree, and from the feedback, the most prescribed antimicrobial is antibacterial. So this actually tells us a lot of things that this antibacterial really needs to be preserved. Together, we should do something such that this antibacterial will not be misused and will not be overused. Okay, that leads us to the second question. In recent days, is antibiotic misuse common? In my area, I have my own answer. In your area, is the misuse common? Do people just come with doctor's prescription and bring the prescription to the pharmacy and say, pharmacist, this prescription, this is doctor's prescription, this thing? Or do people even come and just say, walk into the pharmacy and request for whatever, let me just get to hear your view. It could be something I've not mentioned, it could be anything, just let me hear your views. In recent days, is antibiotic misuse common in your area? Since we have selected antibacterial, all of us said the most common one is antibacterial. So is antibiotic misuse common? You can still send the answer on the chat box, or yes or no. That would be yes or a no. Okay, please let's type in chat box so that, okay, I'm with yes. Okay, yeah. From Mary Jane, yes. Okay, thank you for your feedback. I would really like all of us to participate. I can see that a lot of us have been in. It's very interesting to see all of us. Okay, a strong yes. Okay, thank you for that. Anyway, okay, so with that strong yes, it actually shows that I can actually continue. So in recent days, antibiotic misuse is common. It's something that is very common in our area. So for the last question before we're now, in what way, if you say a strong yes, say yes, in what ways have you seen patients misuse these antibiotics? Just one, just few answers. What ways? Because this will actually be very important for us to actually lay a good foundation. If we see that it's not being misused, then perhaps there may be no need for us to actually still just talk about it, just to encourage ourselves to continue to write things and continue to do what we always been doing. But since together we have actually seen that there is actually a challenge, and let's look at those challenges together. From Olufemi said, dosage regimen. Okay? If one thing that personally I feel strongly, one way in which a lot of people abuse or misuse antibiotics. I'm sure lot of people that work in the community will, even with doctor prescription, someday they will get to say, oh, just give me maybe a card, I'll come back for the rest, stuff like that. Even after you trying to encourage them, something that more comments, please. Dosage regimen, I agree with you. We have more comments. Do we have? Although, should you, okay. From Ruth said, most claim to use it to flush their system. I agree with you. Please, I want us to know that no answer is a wrong answer. It's just for us to let's get to learn new things. Let's learn what is happening in your area. Most claim to use it to flush their system. That's a nice one. Anyway, especially the Ampiclox brand is one that personally I have experienced. If you have one using antibiotics for viral infection, yes, that's a good one. These days, you get to see people coming down with flu. It's a common one. In fact, over I think last week, I had to actually still educate someone on this. This is a common one too. Thank you. Sharing from iPhone, okay. Long prescription for improper therapy. Okay, another one using antibiotics for a shorter duration. Right here. That's a good one. Long prescription for improper therapy. Okay. That's drug therapy problem. So, because we are using a gram-negative antibiotics to treat this condition, to treat gram-negative positive organisms, definitely you wouldn't get the results that you desire. Antibiotics for shorter duration. Right? So that one is also a good one, because at least, in fact, this is one cause in which resistance actually still sets into, because you are not really using the right, the duration is very, very short. So, okay, many thanks for everyone that's actually shared this for our own view. Thank you. And using antibiotics as growth promoters for animals. Yes, from G, yeah, that's a great one. In fact, these days it's one thing that together for everyone on this call, I would actually appreciate that together we actually come against the use of these, because these days people just pick antibiotics in pharmacy and they use it in livestock, which is really way, way wrong. And you get to see that even in the course of them, perhaps these are livestock that are being sold. may just give and they get to sell, and of course there could still be of course the presence of those antibiotics that was given to the animal in the consumed those consumed meat. So this is actually wrong. We would actually lead to an start. So thank you everyone for your view and your comments. So I think we'll run fast. So the fact remains that antibiotics, just like we have said, is the most prescribed, saves lives. Since the discovery of penicillin, these days we have the newer generation, the first, second, third generation cephalosporins, common ones that we know. It has actually been very helpful. If you and I know these days, the common condition or sickness in Nigeria and blacks generally, we tend to see when you see malaria and typhoid, in fact, if you do a research or count and go to the hospitals and see different complaints, we will see that malaria and typhoid is actually top charts, gapping the other ones. So these are common ones, and the antibiotics for different antimicrobials that we use have actually been very helpful. Thanks to all the antibiotics that we use. Well, what will we be talking about now? Because it has actually been very helpful it has actually been very helpful. So antibiotics actually save lives, and that's a fact that all of us actually know. For other ones, antibiotics destroy species responsible for infection or also eliminate bacteria. Okay. The reason, the rationale for this is because if you is for us to actually understand and know that for these antibiotics that is being given to patients, we shouldn't actually misuse or overuse these antibiotics, because definitely for the microbiota of human, for example, microbiota, what I mean by microbiota is an ecosystem of bacterial, fungi, viruses living together in an environment. And when I mean environment, it could be the gut, it could be the vagina, it could be the lungs, it could be the skin. The set of microorganisms in that area have they are beneficial microorganisms in that area. But the beneficial microorganisms in the gut, when it's no longer in the gut and is found in the vagina, it is no longer beneficial. It becomes pathogenic. So for the beneficial one, of course, we have pathogenic and we have beneficial microorganisms. And the rationale for giving antibiotics is to eradicate the pathogenic microorganisms. But in the course of eradicating pathogenic microorganisms, the beneficial one is also taken care of. The beneficial one is also reduced. The beneficial one has a lot. Studies have shown, in fact, perhaps at the end of this, I can actually share different materials on how the human microbiota, how what's the future of human microbiota, because this is what is actually being considered in many disease conditions where right now we do not really have specific drugs that is being used. Disease conditions like autism, attention deficit disorder, even mood generally. Let's talk about that. So the destruction caused by antibiotics stem dysbiosis. Dysbiosis is for us to make it simple, there are situations where you have the beneficial microorganisms, general microorganisms in a particular environment. For example, let's say the gut. When you have the pathogenic one more prominent than the beneficial, such condition is termed dysbiosis. When you have all of them living together in a balanced, when they are balanced, that condition is termed eubiosis. But the disruption caused where you have more pathogenic than beneficial is termed dysbiosis. So one of the facts, the second fact, that antibiotics destroy species responsible for infections, but also eliminate good bacteria. Then all of us know that different drugs that we take in actually have side effects. So drugs are not free. Of course, we actually just need it at different points to help improve a lot of take care of different infections that could arise as a result of environment or in the course of taking it, some side effects could actually occur. Research has actually shown that people that actually take antibiotics, 3 out of 3 of them will actually experience what we still call dysbiosis. So it actually could manifest as in different, it could really be mild in some, and could be really severe in some people. Of course, you and I know that there are different conditions of practice. Experience has actually shown me that drugs like amoxicillin, clavulanic, in fact, from research, it has actually shown that a lot of children, adults, experience antibiotics associated diarrhea when they take it, and also for erythromycin, even others too. These are common things associated with antibiotics. They also have side effects. And inappropriate use of antibiotics is responsible for antimicrobial resistance. Antimicrobial resistance happens when antibiotics treatment is no longer effective against bacterial infection. This is becoming common these days. As all of you will agree with me, we said the use is way high. And as you can, from what we have actually agreed together, or at different points, even for people with flu, they get to use antibiotics, they misuse it. It will come to a time that definitely you get to use and you will require either an increased dose or even the drug will no longer be active such that you will need to. What actually, the problem these days is that even the broad spectrum antibiotics is now being misused. And this is way wrong because if we get to see resistance in broad spectrum antibiotics like even the reserved one, we see the third, fourth, cephalosporins, for example. These are drugs that are meant to be reserved, but studies have actually shown that these days prescriptions and there is gradual misuse, increase in the misuse of these drugs, which is very risky. As pharmacists, we are expected to let's come together and see that this going forward, this is actually checked. Because if it is not checked, by the time resistance microorganism, strong pathogenic one comes up and we use this and we are seeing failure, there's high resistance, it will be a huge problem for all of us. Let's get to sit together and save the future generation. Of course, we all know that antimicrobial resistance leads to longer hospitalization, higher health care costs, and even death in some cases. And right now, it has become a major public health concern worldwide, not only in Nigeria, even worldwide. But of course, for Nigeria, it's way very high. So it's something that we could actually look into. what are the challenges? That leads us to what the challenges are. The challenges associated with antimicrobial misuse. Okay, I think I have actually been speaking so that I'll be sure that everybody is equal. If you're with me, just say hi on the chat box so that just say hi, let me know. If we are still together, just type hi on the chat box. Okay. Okay, thank you, thank you. And also, if you can still hear me, if you can hear me well, just type yes, yes on the chat box. Yes, thank you, from Brian, from Thank you, okay, thank you. Really grateful. Thank you for um, your attention. Okay, so challenges associated with antimicrobial misuse. Antimicrobial misuse. Okay, right now we have seen that there's increased use of antibiotics, even among healthcare providers, like even the physicians. We get to see research has shown, recent research that has actually shown that for every prescription that comes out a day, we'll get to see more than 60% of every prescription, more than 60% of those prescriptions will come with antibiotics. So that's to tell you that there's a rise in the use of antibiotics. There's increased misuse of antibiotics. Yeah, just like we said, dosage, regimen, people using it to flush their system, actually shared. For different ones, just going maybe just give me a capsule. It's a common practice in Nigeria. Maybe that's reduced these days, but it used to be common then. I believe that one. Then for IQ, we are in a situation where for people in Lagos, some of us live in such environments. Even for those that actually live in such environments, we still have some windows around us. Before I go in places like where we are, we are actually in solar axis. This place is actually crowded anyway for different areas too. People find themselves. There are areas that you yourself can see the ideal level in the area and you know that this is really poor. These are actually different ideal level when you see them overcrowding areas where there's no good drainage system and all. So, okay, and this could actually, of course, cause different. It could actually make infections to be on the rise, which definitely you will need antibiotics to take care of a lot of things. Antibiotics used in livestock, which we have mentioned, is also a challenge that you and I also know. So that leads us to the antimicrobial resistance itself. And what is this antimicrobial resistance? Antimicrobial resistance occurs when bacterial, fungi, viruses no longer respond to medicine. I'm sure I've actually mentioned that earlier. It makes common infection harder to treat and increase the risk of disease spread, severe illness, and death. We've mentioned it. And together, we've said it could actually ultimately determine a lot, could undermine a century of medical progress. Over time, we've seen, okay, look at then, okay, I had then before the advent of the cephalosporins. It was the earlier ones were, I think, chloramphenicol and all. And you and I know the side effects associated with chloramphenicol. This was actually the most commonly prescribed drugs for typhoid then. And according to before the breakthrough of chloramphenicol, typhoid used to be a very severe But you see, different research all has actually helped us to come up with newer, safer drugs, which together, if we can preserve this, it will go a long way in saving future generations. Antimicrobial resistance has caused over 50,000 deaths each year in Europe and United States. And it's still a major health problem, like I said. Then what is our role as pharmacists? The time is actually fast gone. We just try to see that wrap everything up in a few time. The role of pharmacists. Of course, the role of pharmacists cannot be overemphasized. You and I know that there are lots to actually do. Patients, we first of all should actually be an example, because over time I have actually seen cases where even pharmacists or healthcare providers say, "Oh, this prescription, they are the ones that will not even finish the prescription." I'm sure some people may actually be guilty of that in this call anyway. But for people around us, let them see that we set a good example. And for other things, the counseling, the education of patients is very vital. These are key roles that we could actually play. A lot of them at different times. If you and I know that once they know that you're a pharmacist in your immediate environment, you become a doctor or they for every advice on health. I'm sure a lot of calls they will definitely be banging on your door that, okay, see, this and this and this and this. So it is our duty to educate them properly, tell them to seek medical advice when it is not really good to self-medicate. A lot of misuse of antibiotics has actually been attributed to self-medication. It is important for them to seek medical advice, and it is important for them to take antimicrobials and antibiotics and other antimicrobials only when prescribed. It's good for patients to complete treatment regimen as prescribed. These are things which we can actually, even in our daily practice, for those that will come and perhaps because of the knowledge they have, they may still not understand. A lot of them do not understand anyway. But I believe we at different points, when we get to meet a lot of them, it is good for us to, with a lot of education and counseling, I believe a lot of things will actually change. In fact, pharmacists they are well respected, and there's actually at different points, pharmacist profession at different points, when they come, they respect hospitals. And let's take advantage of this to actually make them do the right thing. Another way is preventing infection, at least through proper and good hygiene. Encourage them for those stock screening system, that are not growing. It is important for you to advise them. For people, you get to see a lot of patients, for some of us in community pharmacists, where on different occasions, maybe every 2 weeks, the patient is always coming for. It's not perhaps typhoid is always there every 2 weeks. It's good and it is important for us to advise them the right way to actually go about it. It's like somebody is raising up. Okay, maybe at this point, of course, definitely I will actually appreciate at different points. If anybody has any contribution or even questions, we can actually put it together at different points. Very quickly, Unamdi, you can unmute yourself and actually see what you have to say. If you are truly raising your hand, or if it's not a mistake, you can unmute yourself and talk. Unamdi, are you there? Okay, I will continue. I'll continue. Okay. Okay, this pharmacist is very, very important. our constant counseling and education of patients and not be very precise. These are ways in which we can actually really still show that we've got. And we at Merit Healthcare Limited, just like I have mentioned, what antimicrobial is very crucial to us. Our emphasis has always been on antibiotics induced dysbiosis, which I have mentioned before. We care about human microbiota. We have seen that microbiota, just as I have defined it, microorganisms that are found in specific areas in the body. And research has shown that even if antibiotics is misused, it could actually have effects on it could actually have effect on for questions at the end of the presentation. I'll just quickly take that. So I'm actually wrapping up now. So the microbiota, just like I mentioned, colonizes place in the body. The antibiotics have actually been shown, especially the ones taken in the gut, to actually have effects on even the beneficial microorganisms. And that is why our interest actually comes in. It's important for pharmacists and healthcare practitioners to ensure that everybody will do the right thing, such that because of doing this, the human microbiota, the gut microbiota, the beneficial microbiota is preserved. And different reasons for this. We've seen when it is well preserved, research has actually shown its effects in, just like I have mentioned, in the future. Research is actually looking at having a balanced microbiota, taking care of some disease conditions like the attention deficit disorder, for even allergy, obesity in children. Research has actually linked human microbiota, a balanced human microbiota, that there are this biosis booklet that I actually share that could give us more information on this. And why is the human microbiota important? Just like I have mentioned, it plays an important role in resisting intestinal overgrowth of externally induced population. In this case, when we have a balanced microbiota, it reduces the frequency of need for us to actually take antibiotics, because the system automatically, for example, in the gut or wherever, it automatically balances different microorganisms that could actually be. Research has actually shown that having a balanced one, you just see your system automatically taking care of even some of the pathogenic microorganisms. Because when the beneficial one is actually pronounced, it confers a huge lot of benefits to us. Imbalance, like I said, is dysbiosis. And antibiotics, everybody that takes antibiotics will experience dysbiosis. So at different points, antibiotics are good and they are essential. But what we are preaching here is, if there is no need to take antibiotics, let's encourage our patients and everyone around us not to take. We should just take when necessary. What are the factors that cause this dysbiosis? The genetic lifestyle, the genetic factors, lifestyle, medical, drugs, infections, all these could actually attribute to cause this dysbiosis. And the consequences of dysbiosis, which are caused by these antibiotics, include the inflammatory bowel diseases. For who are the patients around you that are suffering from inflammatory bowel diseases, childhood obesity, irritable bowel syndrome, allergies, psychiatric disorders, even antibiotic treated diarrhea. This we can see that a lot of this can actually be solved if we actually antibiotics use is well taken care of. If we reduce the misuse and overuse of antibiotics, this disease condition can actually be taken care of. And how do we get to prevent these dysbiosis? Of course, we adopting a more diverse diet, use of prebiotics. Prebiotics are like supplements that serves as food to the beneficial microorganisms, and probiotics are life microorganisms that when we give them confer health benefits of the host. We have both the bacterial and yeast type. Of course, examples of yeast include we can get like the bowel flora and all. But this can actually be co-prescribed with antibiotics at different points too, such that if you have patients that are on antibiotics, especially long-term antibiotics, it's important for you to protect their gut such that these antibiotics induced these biosis is taken care of, and probiotics like bowel flora is one that can actually be used. I would say no boundaries anymore. No boundaries anymore in patients and also in even as we the pharmacists. In patients, we get to see that there's no boundary, and you get to see patients actually they are the ones that actually come to us for the drugs that we even do not want them to take. By the time some of them, by the time they are not well educated, you get to see that one way or the other, they still they have access to some of the drugs. We keep wondering how do they even get to see all of these drugs? So the patients on their part, the access to drug, something that they can easily get these days, because of course we know the situation in Nigeria. But what we can do as pharmacists is knowing that okay, at different points where we get to interact with these people, let's tell them to do the right thing. And I'm sure. Okay, this is a video, but in conclusion, let me just conclude because time is almost up. I just wanted us to look at that, but time is up. In conclusion, I will say that the overuse and misuse of antimicrobials are the main drivers of drug resistance pathogens. We as pharmacists are already empowered. Of course, being a pharmacist, we all know what rigorous trainings that we actually went through in the course of school. We are already empowered to preserve antimicrobial and prevent resistance. I am saying, and together we are saying, together we can stop awareness, we can spread awareness, and we can stop resistance. Thank you so much. If there are questions.
Thank you very much, Dr. Alex, pharmacist Dr. Alex Wenger. Thank you very much for that very educative session on AMR. Thank you very much. I hope we're able to take away a thing or two from the webinar. And what I took at the end is the part where he said we as pharmacists are already empowered to prevent and spread awareness on antimicrobial drug resistance. So as pharmacists, we're empowered with the knowledge, we're empowered with the training, we're empowered with the education. So we need to put our foot on the ground and spread awareness. We need to educate our patients. It's not just telling them about, oh, you're not supposed to use this for this time, or you should finish your regimen. Basically explain to them, educate them properly. Yeah. I hope we all learned a thing or two. I think we'll just take the questions now. There is one, okay, so Oluwafemi is asking, what do you have to say about viability or profitability in the community pharmacy setting and the need to maintain antibiotics stewardship? Okay. Would you take that question? Then I read the second one.
Okay. Thank you for the question. The truth is, just like Temi mentioned just now, we as pharmacists, we are already empowered to actually, we have everything. In the course of the training, we've been empowered to know the right thing to do. We are different from the patent medicine dealers, or we know the right thing to do. Of course, by the time there is the proper education of this patient, it's not really, we shouldn't base everything on the profits, and let's not base our profession. Definitely, if you know what you're doing, if you know what you're doing with the right message, patients around you at different points will respect you for what you do, and on the long run, you may feel you're not doing the right thing initially, but on the long run, with the proper education, with the proper counseling, when they come to you, it's not really about the profit. You get to tell them a lot, one few things, educate them on the right thing to do. On the long run, it stands you out. And of course, not only you, the society at large will also benefit from that. So on the profitability in community pharmacy, let's do the right thing. What I have to say about that is, let's continue to do the right thing. We know as pharmacists, we're already empowered. Let's stick to that we know, and on the long run, continue to speak for us. Thank you. I hope that answered your question.
Oluwafemi, I hope that answered your question. The second one is, with respect to sensitivity testing, where a pathogen is sensitive. Sorry, with respect to sensitivity testing, where a pathogen is sensitive, where a pathogen is sensitive different, where a pathogen is sensitive different. I honestly don't understand what this person is saying. Can anybody else?
Respect to sensitivity testing, where a pathogen is sensitive, different antimicrobials, which will be best to.
Oh, okay. With respect to sensitivity tests, where a pathogen is sensitive to different antimicrobials, which will be best to use? Yeah.
Of course, if you actually see, with respect to sensitivity testing, there is a reason for one in the first place to, of course, anybody can actually contribute to this, but from my own point of view, why the sensitivity test in the first place? The rationale for the sensitivity test is for us to really be sure of the right antimicrobial, the right drug to use. So from the right results, because it's important for us to know that these days, of course, there are results that you tend to see and you can actually query, because if you actually do, what's it called? You do a sensitivity test and for gram positive, for example, and you see different gram negative drug being the best for gram positive organisms, that tends to actually raise a lot of questions. Or for experts, like I said, we for the sensitivity testing, it is specific, so it's way easy. This actually already shows us the best to use. So for good one, where a pathogen is sensitive to different antimicrobial, which is best to use, I believe from the results, it will clearly show that, except maybe I do not understand what you mean, Nnamdi, at this point. Perhaps at different point you could actually omit yourself and make it clear. But from here, what I think is, with respect to sensitivity testing, where a pathogen is sensitive to different antimicrobial, to me, if it is sensitive to different antimicrobial, we could actually select, for example, a broad spectrum, one that is not as broad as, we could actually, if it is sensitive to a lower one, we could actually pick that lower one. And depending on the patient, history too, some could actually be sensitive to different group of antibiotics from questions, the one that the patient is more comfortable with. Those are questions that will actually be asked, and for you to actually consider the best one to use. There is no one way in actually picking the best antimicrobial to use at this point. There are different things that are centered around picking the right thing to do, the right antimicrobials that will be used. In this case, patient history, age, and even different other factors too would actually be considered in picking the antimicrobial that will be used. Thank you, Namdi. I hope that answers your question.
So do we have any other questions? Thank you very much, Dr. Alex, pharmacist, Dr. Alex. Do we have any other questions? Is there any other person that wants to clarify or ask any question, or do we have any remarks? Okay, in the absence of none, I'd like to bring this webinar to a close. Thank you very much, Dr. Alex, pharmacist Dr. Alex, for your time. Thank you for taking your time to educate young pharmacists. On behalf of PSN-YPG Lagos and young pharmacists, to say a very big thank you. I hope everyone that tuned in, I hope we've learned a thing or two today, especially the part where it urges us, challenges us as pharmacists to do the right thing, which is create awareness and be antimicrobial stewards. So even in the community setting, hospital setting, wherever setting you find yourself, don't ever pick profitability over doing the right thing. It should always be to do the right thing first, and money would come. So thank you very much for your time. Thank you so much. We would like to bring this to a close, so you can give us your closing remarks and then we'll end.
Okay, I would like to appreciate everyone on the call. Thank you for having me. It has actually been even an educative one for me personally. At least getting your feedback too has actually been very encouraging. I'm sure we'll get to still gather together and get to see ourselves physically too and know ourselves better. Thank you so much. And just like they have said, let's spread the awareness and let's prevent drug resistance. Thanks so much and have a great night.
Thank you very much. So you can drop a remark or thank you to the facilitator. You can drop in the comment section for the next 1 minute. So I'll just leave it there for him to read. I don't know if anybody wants to get his email or his LinkedIn profile. If anybody wants to reach out to him, so you can just drop it here. I don't know if you're comfortable sharing your email. If you're not, you can just drop your LinkedIn profile so young pharmacists can connect with you. Okay, so we have his email address in the comments. You can quickly take it down. We are about to go, so thank you very much once again to everybody who joined. Thank you so much. We hope that you have learned a thing or two on AMR. Thank you. Have a good night, everybody.